This is another patient of mine. She's 6 weeks out from some lipo contouring along the front. You're starting to see her definition come through here. It takes probably, once you're like 3 months out, you really start seeing the definition even better, especially along the center line. And 6 months out is when you really see it at the end. She had some fat transfer to the hip area, some to projection, and then of course we lipoed all along the upper back, as well as the lower back. And then turn to the side for me. So you can see she has a really nice contour coming out this way, and then it blends into the back there. The area that I notice the most swelling on that Ty will go over especially is this upper back area. It gets a lot of swelling, and as a result some pain associated with it until people are farther out, but she has some tips as to what to do with the faja.
So first thing I noticed is that she does have some localized swelling that's inside of where you etched at. So I would put you have your marker on you? I would put 2 pieces of KT tape. So the KT tape, it comes this long. Cut it in half. You'll use less. You'll put your anchor point here and go straight up, and then another one here and go straight up, or not straight, but at a diagonal. Same thing here and out, and then here and out. And what this will do is it'll lift the skin up internally. Imagine if I were to wash some sheets and the sheets are just here and they're outside on the line. If you don't hoist it up, it's not going to billow in the wind to dry off, right? Same premise. So by hoisting the skin up from here to like this, it'll help get rid of the actual the acute localized fluid that's accumulating in these little quadrants around where he did that extra definition. Okay. And now if you turn to the side, her sacrum is good, but then in this lower back quadrant, there's a lot of congestion here. And then on her sides, have your massage, who's doing your massages?
Ray, the Royal Spa.
Okay, tell her I said to have your massage strokes start to go up. Mm-hmm. It'll encourage the skin retraction in the right way, and then your inguinal lymph nodes are swollen and overwhelmed, so you are gonna take your foot out, turn to the side, take your hands. Can you hold the Dr. K? Thank you. And let me move the phone out of the way. You have your foot out to the side. Take both your hands, put it where your leg meets the torso, and you're gonna massage in little circles right here. Okay. No, like here.
Like here? Okay.
Yeah.
Okay.
I think my legs are just light, so lighter than that.
Okay, lighter. Okay.
Yep. Real light little circles around that crease area. It'll help to unclog and decongest your inguinal lymph nodes just a little bit. And then you can do that either before the shower or while in the shower for about 30 seconds per leg. And then have Royal start going up. It'll help to declog this right here. You have tons of fluid, maybe about 2 to 3 inches on each side. So you're gonna have a much more defined curve. He carved the snot out of you. You just can't see it yet.
It'll be there, yeah.
Now when it comes to the faja is gonna help address this area up here. Fluid goes to where compression is not. So your fluid is going right outside of where your faja arms are. If you're able to, reach around, and then you can massage in your axillary area yourself, just right in the area where the faja arms are. And then your garment, I want you to get it taken in above the hip all the way up to the axillary area. So it looks like on here, it'll be from about here to here. Get it taken in on the side. 2 inches off of each side will put you back on the first hook. Okay. Because the amount of fluid that you have for you to be as far as long as you are, it shouldn't be there. Okay. Which also makes me want to talk to you about your diet. What you eating?
No, I've eaten good. I've eaten good. Not as good as I probably should though.
So it's not the what you're eating. When you eat matters, and then the salt. The average American eats between 3,000 to 5,000 milligrams of sodium per day. Your new best friend is an app you're going to download. It's called MyFitnessPal. And I want you to be diligent just for about 2 weeks. Don't change anything, but log everything you're eating, because it'll show you where there's hidden sodium that you may not be noticing. After surgery, for the first, I'd say 3 months, your sodium intake needs between 1,000 to 1,500 milligrams.
Okay.
For reference, a bottle of Gatorade has about 400 or 500 milligrams of sodium, and then a can of soup has between 800 to 1,200 milligrams of sodium. Between just those two things, you've blown your sodium diet for the whole day.
Right.
So a lot of times people say I'll eat good. It doesn't mean you're eating bad. Maryland, born and raised. Wait, no, DMV, born and raised. Eat crabs around the clock, right? Shrimp. I do. It'll be like winter, and I'm like, so what's up with these crabs, bro? But the body, those are they're bottom feeders. The body of a shrimp, it's sediment. So if you don't salt your shrimp at all, it's still high in sodium.
Right.
Seafood just carries a natural higher. So you think you're eating clean, and you're like, why am I still swollen? One other thing that you may benefit from is a water pill too.
Mm-hmm.
But let's try these things out. When does she come back to you for her follow-up?
Oh, we can do it. You can text me.
Okay, I'll
You come back in 6 weeks.
Okay. So take your measurement. If within the next 2 weeks you're not at least 2 inches smaller, then she
Yeah,
can
we
start
can do
a
that.
herbal pill to help you pee out what your body is holding on to.
Okay.
But you look like you're doing good, though.
She said all that and said you look like
But
you're
hold
good.
on. This is me just nitpicking
The salt is
because we don't
huge.
do good
Huge.
here. I like great. I like helping people get great results.
Right.
You didn't pay mediocre money, and we're gonna make sure you don't get mediocre results. So I'll nitpick, but you look amazing. You're doing really good.
The part that, what do you think about putting KT tape in individuals that have a little swelling above the belly button? Do you think it's going upwards is
Yep.
good too?
Yep.
Okay.
Because you want to lift and help that skin retract upwards. The key to putting KT tape on is most people just try to put it on.
Yeah.
You have to anchor it, stretch it, and then apply and rub your hand back and forth over it to get it to stay in place. Most people, they just put it on.
Mhm.
So yeah, if you do it here, or if she wanted to lift straight from here, I'll have people put one long strip here,
Mhm.
put a piece that goes here, a piece that goes here, and a piece that goes here.
Gotcha.
But the key is to anchor, then stretch, and then also there has to be space in between the tape strips. You
Right.
can't mummify your clients.
Right. Okay.
The skin still has to breathe, but you're doing very good.
Oh, thank you.
Thanks.
So do I need to go